So let us say you've been working on your diet and exercise pretty consistently for many years, and still you're not seeing the results you want. This can be incredibly frustrating at this time. And now it might be time to ask, what are my medical options for weight loss? I'm Dr. Sri. I'm a board certified in family medicine, sports medicine, and integrative medicine. To give you the most evidence-based information on this topic, I'm going to share a key segment from my masterclass video on evidence-based weight loss. Afterwards, I'll be back to share some crucial thoughts on how to use these tools effectively. Even with intensive lifestyle interventions, one can lose only up to 3 to 5% of the body weight. Some studies show maybe up to 9%. But then obviously there are a lot of case reports where people have done strict lifestyle modification for years together and have lost a significant amount of weight. But I'm just talking about the studies that show average. So when you pool a lot of studies and then you to see how much weight loss intervention is possible in an average, then you're looking at almost like 3 to 5% or maybe up to 8% or so. So this is where pharmaceuticals and surgical approaches might come, especially for people who are suffering from obesity with a body mass index of more than 40 or so. When patients struggle to curb their appetite despite various strategies, we often discuss medication options. Most of these medications aim to suppress the appetite. For example, phentermine is a commonly prescribed appetite suppressant that can kickstart a patient's weight loss journey, typically resulting in a 5 to 10% reduction in weight. Another medication, commonly known as Contrave, which is basically a combination of naltrexone and bupropion, it helps to reduce cravings and diminish the rewarding sensations associated with eating certain foods. This can be particularly helpful for individuals who experience a strong positive reinforcement from eating sweets, leading them to desire more. However, the weight loss associated with these medications is not very substantial. We're looking at somewhere between 8 to 10% of body weight loss by using these medications. In the last few years, we have had the introduction of the GLP-1 analog injections. So basically, the GLP-1 hormone, you're basically kind of administering from outside, and these medications can suppress the appetite so effectively that can create a substantial weight loss. So the brand name are basically Ozempic, Wegovy. There's also a combination medication called as the Mounjaro, which is basically a combination of GLP-1 and GIP-1. So basically GIP is basically a glucose-dependent insulinotropic polypeptide, another hormone that can help with weight loss. So these combination medications and as well as the GLP-1 analog injections, we are looking at somewhere between 15 to 20% weight loss with these injections. However, these injections are not devoid of side effects, and there is also an increased chance of weight regain by using these medications. I would highly recommend to watch the video that I'm going to link in the description box below on how to use these medications effectively so that you get the maximum benefit from using these injections. For patients with a significantly higher BMI, so I'm talking about more than 50 or 60 or so, in those patients I discuss about surgery. Again, there are a lot of cases where people have lost weight even without any help from like a pharmaceutical component like medications or surgeries. But it is hard. Not everybody will be able to do that. So for some people, there might be an urgency to lose weight faster. For example, they might be having complications that is associated with diabetes. They could be having severe knee arthritis that is causing pain, or they might be having uncontrolled diabetes or so. In those cases, weight loss surgery can be a faster way to achieve weight loss. Again, it also requires intensive dietary lifestyle interventions to make sure that one can make sure that they can lose weight long term, but still the surgery can help people lose weight faster so that thereby they get the benefits of weight loss right away. Currently, the general guidelines for weight loss surgery indicate that it might be an option for adults with a BMI of 40 or higher. Furthermore, weight loss surgery may also be considered for adults with a BMI between 35 and 39.9 who suffer from obesity-related health issues such as type 2 diabetes, high blood pressure, or severe sleep apnea. Even though the guidelines talk about considering weight loss surgery for BMI of 40 or more, these guidelines were done before the introduction of the weight loss injections. Since the weight loss injections can provide almost 15 to 20% weight loss, we don't usually be aggressive about considering surgery in patients with a slightly higher BMI. I still would consider weight loss injections. But again, with a higher BMI of like BMI of 40 or BMI of 50 or 60 or higher, in those cases, I think surgery has far more benefits when it compared to weight loss injections. Although most patients with BMI more than 50 or 60 can still attain the weight loss goal by just using the injections alone. When it comes to surgery, there are two primary surgical options: gastric bypass and sleeve gastrectomy. These procedures come with their risks and benefits, and I strongly advise discussing them with a surgeon or consulting with your primary care physician about the possibility of surgery. So as you can see, there are several powerful medical tools that can assist in a weight loss journey. But the single most important thing to remember is that these are tools and not magic bullets. They are most effective and safest when used as a part of a comprehensive program built on a solid foundation of nutrition and lifestyle changes. So if you want to take the next step, I have two great resources for you to get started. The first one is my full evidence-based weight loss video, which is a 21-minute video where we'll also talk about some essential strategies such as nutrition and exercise to help you accomplish the weight loss goal, and you'll find this video here. If you want to know more about the weight loss injections and how to maximize its effectiveness, then check out this video here. If you found this video really helpful, please make sure to hit that like button so this video can reach more people. This will really help out my channel. If you have any questions, please drop in the comment box below, and I'll see you in the next video. Until then, goodbye.